Hello and welcome to Lynchburg Live. I'm your host, Linda Smith. With advances in medical care, our human population is living longer. The same seems to be true with veterinary medicine and our pets. Veterinarian Dr. Cheryl Simpson-Freeman is my guest tonight, and she'll be telling us about how to care for geriatric and special needs pets. Cheryl, thank you for coming. I'm so glad to have you.
Thank you for having me, Linda.
As we get started, could you just tell our audience where you practice?
Yes, I practice at Manellison Animal Clinic in Madison Heights.
Now, is it a small animal practice that you do primarily?
It is a small animal practice. I also do a little bit of horse work, but aside from that practice.
Now, what encouraged you to go this way as a career choice? I mean, it was something I even thought about when I was coming along.
Well, I hear that a lot from people. It was a second career for me. And I suppose the first time through school, it wasn't something that I really had the courage to pursue. But as I got a little older and I was approaching my 30th birthday really before I thought about it, I realized that other people saw me as someone that they would ask questions about their animals. So I started seeing myself in that regard and just decided to go back to school and see where it went, and here I am.
You know, the thing that kept me from doing it was I was afraid that I wouldn't be able to handle sick animals. You know, the healthy ones I could have handled all day long, but then do you have a specialty?
Well, per se, if one has a specialty in veterinary medicine, it requires additional schooling to be board certified. So I've not done that, but I have a special interest in cats, and especially geriatric cats are my love, my passion.
And you have some of your own
I do,
that are
we
geriatric
do.
cats.
We do. Our oldest will be 21 in February. And then we have one that's 20 and a couple others that are seniors that are behind, and a couple younger ones.
That certainly speaks to the good care you've given them. Now, I understand that you also are one of the few veterinarians that do acupuncture.
I do.
You want to tell us a little bit about that? I thought that was really interesting.
Sure. I even brought some acupuncture needles because it's kind of neat to see how small these actually are, because a lot of people hear needle and have some fear associated with that, but I'll try to get this out and hold one up. Very, very small. So believe it or not, cats and dogs are very receptive to acupuncture and respond very well, and I find it particularly useful with the geriatric population.
That's good. Yeah. They don't have any preconceived ideas.
Exactly. They're not worried about it, and the needles are painless. You know, once in a while I'll hit a sensitive place, but as a rule the animals just zone out and relax, and see a lot of benefits from it. You know,
one of the questions that I was going to ask you a little later was about arthritis in elderly pets, because I've had a cat that had arthritis and lost the ability to jump up on the bed and that kind of thing. Is the acupuncture good for that, or? It
is. It's very good for arthritis. That's one of the big conditions that I use it in. And, you know, with cats, we're so limited sometimes with medications because they don't handle medications as well as dogs. So it's really nice to have something else to be able to offer.
I think that's wonderful, and I'm glad to know that you do it, since you are in our veterinary hospital.
Oh, thank you.
So what is the normal lifespan of a dog or a cat?
Well, that's a good question. I think it's quite variable in dogs. You hear rules of thumb, like a dog year is, 7 human years, and I don't think those really pan out so well. With dogs, the size determines so much, and the giant breed dogs, you know, they don't tend to live as long. You know, they may die at 8 or 9, whereas you may have a toy breed, a very small dog, that it's not unusual to see them into their late teens, and so it's a little more difficult to have an average that makes sense for dogs. I think for cats, the average is probably still around 13 or 14, but it's like in humans, you know, if our average lifespan is 78, we still all know individuals that live to be well into their 90s, vibrant and healthy, and even 100. So we see that in pets too. You have your averages, but we certainly have, you know, both ends of the spectrum.
Do you think that some of this is due to better veterinary care, or the fact that owners are more responsible these days?
Hopefully some of both. And you know, animals have come inside now, whereas you look back 40 or 50 years ago, and that would have been a very unusual thing. But our animals are very much more part of our lives, and of course when they do live inside with us, that also cuts down on a lot of attrition to wildlife, or being hit by a car, or you know, other ways that they could die before their time.
Right. And in fact, I heard on the news today about a rabid fox that was somewhere. People were taking in their smaller animals and not leaving them outside. So I do see how that can contribute to the longevity. So what diseases and conditions do we most often see in geriatric pets?
A lot of the diseases that we see are similar to those that we succumb to as people, but sometimes for different reasons. We tend to see kidney failure is a big one in cats, and we see it also, of course, in dogs. I think cats tend to do better longer with it. We see diabetes, and some of that is a result of lifestyle choices, just as in people. Certainly cardiovascular disease, but not in the same way that, that people experience it. But cats and dogs have their own forms, and we see a lot of cancer, the same as we age, and we're more susceptible to cancer, the same with our pets. We definitely see more cancer, so those would be some of the big ones that we see. You know,
that brings up a question. Being a survivor myself, I've noticed there's so much more cancer. It just seems to be. Do you see, is that the trend in veterinary medicine as well?
Yeah, I don't know if we're actually seeing more, or maybe, you know, picking up on it sometimes earlier.
Right.
And you know, some of the cancers in pets, just like in people, are extremely treatable, and that's a message that I would like you know, to get out there too, is that particularly like lymphoma. You know, I know cats and dogs that are doing well 3 and 4 years post-diagnosis, and so I think that's the important thing to know too. If you're faced with a cancer diagnosis with your pet, is it doesn't mean that that's the end. That many times we can look together and say, okay, how can we make this pet both as healthy as it can be with cancer, and you know, how long a remission can we achieve? And lots of times that happens without, you know, heroics. We're not talking like always a lot of expense, or we certainly don't see pets suffer the side effects of treatment, because we have different goals. You know, they live in the immediate, so when we treat them, that's how we think about it. We don't want their treatment to involve suffering.
Right, and quality of life.
Exactly.
Just
important.
Like you would with your grandmother or yourself.
So important.
You know, you think about your quality of life, and you certainly don't want your pets to be lingering and in extreme pain and that kind of thing.
Right, and not just with cancer, but just with aging. We're seeking quality, not just a length. You know, we're not just seeking to lengthen the life and say, you know, my pet lived to be X.
You know, pets that have diabetes and thyroid disease and cancer, how did they present? Because, you know, animals are notorious for suffering in silence, probably more so cats than dogs.
Yeah, well, some of the things that you might notice as an owner, depending on which of those diseases, I mean, changes in water consumption, litter box habits, appetite, just any changes that you notice in behavior. And of course, to notice these things, you do have to be tuned in.
Right.
And I would say just bring any of those to the attention of your veterinarian and explore it together to see. I am a fan of just doing like blood work just as a screening, even when a geriatric pet seems healthy and is not exhibiting signs. Sometimes we can pick up on those diseases early before they're sick, and that's a good time to intervene.
I mean, you did that with our cat, and I at least we know what we're looking at. You know, he's 10, 15 now, and at least we know that he's starting to get some problems, and so we're prepared for that. It's not something that's going to hit us just all of a sudden. So what challenges do dealing with geriatric pets and their special needs present for their owners?
Well, of course, it again depends on the condition. But I think as a veterinarian, I try to look at the whole family situation. And, you know, I've had owners who have challenges themselves, like visual challenges with a diabetic pet. Well, we have to figure out together, you know, is measuring insulin something that person can do with a visual impairment? And so the challenges kind of run the gamut, and part of that is having that relationship you know, with the owner, and just knowing what their situation is, and then trying to figure out together, you know, an 80-pound dog with bad hips who has trouble getting up, and then a small woman who might be elderly herself. You know, these kind of challenges. Right. So lots of times we try to look at those situations and come up with an individual plan that's going to be different for each individual owner, so the challenges run the gamut, as you might imagine. So
you're doing essentially what doctors these days are doing with people. They're looking at the whole picture and not just the patient.
We try. That's where having that relationship, you know, is so important. That you've known someone beyond just the first time they present with an animal that's sick. It's a little harder to step in then sometimes. I mean, we do our best, but you don't know the whole situation. Right. And so a question I get asked all the time is, what would you do if it were yours? And that's a difficult question, because my situation may be totally different than the client's. And so I try to answer that with the compassion and with whatever level of understanding that I have of that individual situation. But, you know, the answer varies.
Yeah, I'm sure it does. You know, you mentioned kidney failure and kidney disease in cats, and we've had 2 very old cats, so we've lost to kidney failure. And is there anything you can do to prevent that as you're going along? Diet, anything? Yeah.
Kidney failure is certainly a condition that we see very, very commonly in geriatric cats, and it is an interest of mine, and I think because cats with kidney failure tend to do so much better than dogs. I don't know if we know why, but
they're stoic.
Yeah, I don't know, but even once we start treating them, many times I think people hear the word failure and they think that, well, if their appliance fails, they need a new one. And so if they hear that their animal's in kidney failure, or the word might be renal failure is another term that we use, they assume that's the end. And I think the neat part about cats is it's not unusual for them to go on for years. Right. You know, I've seen some of them that I've known have had significant kidney impairment for several years, and there's not anything to do to prevent the onset, but there's an awful lot that we can do once they're already having some kidney insufficiency or kidney failure to make that a long, slow decline with good quality of life, instead of sometimes it's not noticed until the cat is losing weight and ill, and it's much harder to bring them back then. It doesn't mean that we can't. Sometimes we can get them back up on their feet and feeling well for a few months, but it's not the same as if we pick up on it early and are able to intervene. So I brought a few things to show you that I actually use with kidney failure cats, and depending on the stage. And I didn't have any cat volunteers, so I brought my little stuffed kitty here to show. So there are quite a few things that are helpful, and depending on the stage at which your cat is diagnosed, then one of the important functions of the kidney is with water balance in the body. And so one of the first ways to intervene is actually canned food. And Linda, you know, I'm a huge fan of canned food for cats as just being the way that's closer to the way they would eat if they were hunting for themselves. And so you know, if you have a kitty that's always been eating dry food and you find out that it's got some kidney disease, one of the first things I would say is this is an easy way to get water in your kitty. Right. And in addition to feeding exclusively canned food, a lot of kitties like cat soup, which I take one of these cans and mix it with a can of water. And you can get an awful lot of water in them that way. But at some point, your veterinarian may tell you that that's not meeting kitties' needs anymore. And I've had quite a few owners learn to give fluids to their kitty at home. And this is, people refer to this as an IV bag.
Hold it.
Sure.
A crisis.
And we do use it intravenously, which is what IV means. But we also can give it to cats and dogs up under the skin. We call that subcutaneous. And this is something that you can learn to do as an owner. And you know, many cats will go for years just getting a little bit of fluids once a day. They get used to it. They don't mind. In fact, my kitty that's been getting these fluids, the one that will be 21 in February, has been getting them for at least 3 years daily, and she's restless in the mornings until she gets her fluids, and she kind of paces around, and then she just comes and sits down, and we have a few medications that she gets, and all this whole process takes less than 5 minutes. And it's just her morning routine, and she likes her routine. Cats like routine. And the older they get, the more set they get about their routines. But it's a very simple process that your veterinarian can show you, and we use this loose skin that we've got to put, it's about 1/10 of a bag that most kitties get. And once a day, and you just insert the needle quickly in that space of skin. The only part that hurts a little bit is going through the skin, and if you do that quickly, they don't feel it. So it's kind of like if you ever played with your finger in a pen when you were a kid. I used to do that. Maybe I was just a weird kid, but you realize you can just put it under the skin and it doesn't really hurt. I don't know. That's just a kid thing, but same kind of thing. And so they sit there and they get their water, and there's not every cat in the world that's going to accept this, but most of them will. And if it's something that you feel like you can do as an owner, I would just say practice a few times with your veterinarian staff and get comfortable with doing it and try it at home, because if your kitty, gets to this point, and this is not the first stage of renal failure, but let's say stage 2 or 3 out of 4 stages, it can really extend your kitty's life by years.
And this is sort of, just listening to you, it's sort of like a kitty dialysis.
Sort of,
it's flushing the kidneys.
Well, that's a way to think. That's a way to think about it, I guess. It's certainly not as complicated as dialysis, but it's what we can do for pets, and it's something that owners can do. Many can do.
I imagine that there will be some that wouldn't be able to, because some people can't give a cat or a dog a pill.
And we'll talk about that too. And there are a couple medications that I use a lot. With kidney disease for cats. This is one of them. This one actually can just mix in the food, and most cats will eat that readily. And that helps absorb one of the products that builds up in the blood that makes cats feel bad when the kidneys are not working. It works on the phosphorus. And there's a companion product that goes with this too that I use often with it that helps take a little workload off the kidneys. So there's quite a bit to do for that particular disease.
Tell me about these natural foods that you see advertised all the time. How effective are they?
Well, I think as a broad category, we have to be careful with any particular. And with any food, I just say go to the label. Read the label, and I'm not promoting Fancy Feast, except that it's just an easy brand to find, and some of the Fancy Feast varieties don't have a lot of carbohydrate ingredients like wheat gluten, and these ingredients like wheat gluten are used to make fake meat. And cats don't need fake meat. They need the closest thing to real meat as you can find. And so whether it's a natural brand or Fancy Feast, I read the label and I just look. Now, the first ingredient here is cod, which is a fish. The second ingredient is liver, which is really good. Third ingredient is meat byproducts, which is fine. They get a bad rap, but they're fine. Then it's fish, fish broth, sole, shrimp. And then you get into vitamins and some flavors. So I would say with any of them, just read the label. And the Fancy Feast, not all of them meet this requirement, even though they sell them for the same price. And some of them they sell for more, but the ones that say classic do. So that's just an easy tip for this particular brand. But you can compare the label and find lots of foods that would meet that label. And there are even a few dry foods that are low carb. But once again, you're not always getting the cat to drink enough water, and cats aren't good water drinkers, so I think that they're better off, with with the canned foods.
And there's so much liquid in some of them, some of the ones that have gravy in them, which seem to be pretty good. Now, this is not a geriatric problem. This is obesity.
Oh, yeah.
How do you deal with obesity? I mean, it is almost impossible to put a cat on a diet, especially if there's another cat in the house.
Yeah. Well, it's difficult, and it was particularly, I think, we realized as veterinarians that by promoting dry food feeding years ago, and free choice feeding, people would just leave bowls of this stuff out, and a lot of kitties still eat that way, and then the food is very palatable, and we end up with these overweight cats that we all think are the way cats are supposed to look. And so I think part of it is retraining ourselves that you know, kitties should have waist and their bellies should tuck up, and most of them have this little swinging, fat pad. So
the swinging thing.
Yeah, and once they have that, they really don't lose that, even if you get them down an appropriate weight. But it is difficult. I adopted a cat that was 26 pounds. We've gotten him down to about 18 or 19 now, and that's probably all he'll lose. He's still going to be an overweight cat, more than likely. But I feel good that we were able to get him down. And one of my favorite simple diets for cats is the Fancy Feast that's low carb, because cats don't handle carbohydrates well. And so I look for the Fancy Feast or a similar cat food that just doesn't have the carbohydrate ingredients. And 2 cans a day, most cats will lose weight on. So you take up the dry food entirely. You might want to mix for several days so that, some kitties will get a little bit of GI upset if you change their food overnight. But once you've mixed it for a couple of days, and if your cat is really what I call a crack addict, which means that they love their dry crunchies and they're just turning their nose up at this stuff, well, you can't let a cat go days without eating. Right. They'll get very sick. So if they're turning their nose up, you can sprinkle a few pieces of their dry food on top of the can to transition them. But once you've transitioned them, 2 cans a day, most cats will lose appropriately without losing too fast. And after several days, they will be satisfied with that and won't be starving and begging. You'll go through a few days of starving and begging. Yeah. But then they're satisfied. They lose weight beautifully, and you'll have a younger cat back generally.
That would be nice. All right, we're sort of getting close on time, so I want to ask you about special needs pets.
Sure.
I think that in just what I've seen, blind animals from birth and with amputations early, they seem to really do well.
They do.
And I assume that just love and attention, makes a big difference in how they get along. But now, what about paraplegia in pets? I mean, a lot of people will have a pet put to sleep. And, that breaks my heart, because you don't have your grandmother put to sleep because she can't walk.
Yeah. Yeah. So, well, again, it depends on the whole situation, but I do see some paraplegic pets. They do require special care, and I think before someone takes that on, they need to be sure that that's something they can do.
Because that does end up in diapers.
Yes, it can.
And a lot. And
yeah. But there are carts, for cats and dogs both, and that can give the cat some mobility. You have to watch carefully for things like bladder infections, and if they're down a lot and aren't able to shift their position, and you don't do it for them, they'll get ulcers just like people.
Do they get bladder stones too, like people? Sometimes
they do.
That's very interesting. Now, hip dysplasia in cats and dogs is fairly common, isn't it? Is that associated with a certain breed?
Well, certainly in dogs. You see it more. Shepherds is a big one that we think of. And it occurs in cats too, I think, unless the cat is being x-rayed or is a particularly bad example of hip dysplasia. We don't recognize it as often because they're smaller, probably, is one of the main reasons. Right. So you have fewer arthritic changes, taking place to show up as what we would recognize as pain or an alteration in the gait. How
about surgery? Do they do
excuse me,
total hip replacements or anything like that?
Those are certainly done in dogs, and it seems to me I read of a special operation done in one cat, but
it was a
typically not in cats.
All right, now what about dealing with terminal pets. I mean, that is such a concern. I think knowing when to do what. Of course, you can't tell me when to do what because we're not talking about a specific animal, but I have seen some owners who continue to keep their animal alive when it's really past time and the animal's suffering.
Yeah.
How does that affect you?
Yeah. How does it affect me as a veterinarian?
As a veterinarian.
Well, I think it's very rare that I feel, that it's my role to tell the person that it is time.
Right.
I'd say maybe in a handful of cases, I've said that. There are many people that want us as veterinarians to make that decision for them, and I try to put that back to say you live with the pet, I don't, and to decide together, because I think that's more of a decision that
Are there support groups? There
are. More for bereavement than for the actual for being terminal.
Right.
But yes, there are. There's a hotline through the college that I graduated from, Virginia Tech, has a pet loss hotline.
That's good to know. And
there are occasionally, groups that will form for a time for owners who have recently lost pets.
We only have about 3 more minutes. Is there anything you'd like to tell me about, if we can get these in?
Okay, a couple of things. One is, I think one of the huge challenges for kitties is medicating them. And
the owner.
Yeah, so never despair if you've been asked to give medicine to your kitty. And if it's in a form that you feel like you can't give, speak up to your veterinarian, because there are other forms available. They're going to cost more sometimes. Right. But like if you're given a pill, this is my favorite pill shooter. It's called Dr. Hansen's. You can Google it, I'm sure, and find it. But you don't drop the pill. And my favorite tip for medicating kitties is to face them the same way you are. They're just less threatened by that. So I'm a lefty. I come atop the jaw like that, and I medicate like this. And I use this little pill thing all the time because it keeps me from getting bitten. Main thing, put it way back. And once they lick, you've got it down. And if it's a daily routine, follow it with the treat. And that way the cat knows, all I have to do is swallow this pill, then I get my treat. And it makes the medicine go down. So a little spoonful of sugar.
Looks so easy when you do it. And when we try to do it, I've ended up giving the cat his pills in pill pockets. And they
that's a great idea. Some kitties will like those. You can also get a lot of medicines made into special chew treats. These are flavored, and a lot of kitties will eat those. We can also get liquids made of medications, and those can be flavored, and whatever flavor you think your cat will find appealing. And for the really tough ones, we have transdermals that can go in the ear. Cool. Some medications can be absorbed that way, not all, but some kitties will accept that better than they will having something shoved down their face. So.
Well, we are totally out of time.
Okay.
I thank you so much for being on this show, and I'm delighted to have you in our veterinary hospital. We've enjoyed working with you with our cat. And I'm sorry we didn't get to the rest of these things.
Okay. Well.
Maybe you can come back again.
Okay, we'll do that. Thank you.
Thank you so much. I hope you've enjoyed watching this show. My next show will feature the Emmy Award-winning documentary Hunter's Raid: The Battle for Lynchburg. Thank you for watching. Have a wonderful evening. Good night.